Dr. Lindsey here. Today, a fellow that I wasn't expecting just walked in. He's 2 years out from a crown case. And for those of you guys who've watched my videos before, the crown's a black hole that sucks up every hair that you put in it. So we did a crown case on this guy, and he's interesting in that, first of all, he's a black guy, and the advantages that he has compared to straight-haired guys is that each one of his hairs, because it's bushy and curly, covers maybe 3 or 4 times the surface area that somebody with my kind of hair would cover. So while our best results in crowns in white guys, using baseball terminology, is probably somewhere between shortstop and third base. Take a look at this guy, and it's similar in bushy-haired Indian guys. If you put bushy hair up there, you can certainly get a triple. I think on this guy we got pretty close to a home run. So issue 1 for discussion is black hair works better in the crown. And issue number 2 is that he has a fantastic scar. Maybe one of the best scars that I've ever gotten in anybody darker than me. And I tell everybody, you got it. You almost certainly are going to need hair in your donor area a ½ an inch long forever. And this guy really pushes the edge of the envelope. He's got almost no hair back there, and we've got good pictures of it. My average scar, we do 133 a year. My average scar winds up that thick. I get 8 scars this wide, and I get 4 crappy scars that are this wide, maybe even a smidgen bigger. We don't have any really big wide scars, particularly on virgin heads. But in order to cover that with thin, straight hairs, you need hair ½ an inch long. So take a look at this guy's scar. It's unbelievably good. Part of it's my sewing, part of it's his healing, part of it is his use of vitamin E afterwards. So enjoy this little video. Thank you. Alright, so it's 2 years since we did this. That looks pretty good. Compare this. I took a video of you at 6 months too, I see. Okay, so we're 2 years and maybe a little more out from a strip on this guy, and that is a pretty short haircut. And that looks pretty good. That's about as good as it gets. That is really a short haircut. I'm going to try to zoom in. So I hope you enjoyed that video. A question that might arise in the viewer's mind is, why didn't we do FUE? A couple things on that. First off, as I've posted hundreds of times before, strip always works better than FUE. This guy, like almost all black-haired guys, or black guys' hair, and Indian with thick hair, and white guys with thick hair, FUE is reasonably safe, but there's always a little torsion when the follicle is avulsed out of the scalp. Skinny-haired guys, I think you're asking for trouble with FUE. But you could certainly do FUE on this fellow, and I can't remember why we chose strip 2 years ago. It may have been money, it may have been recovery time, and it may have been trying to preserve his donor area for future use. But that being said, just 4 days ago we did exactly this case on a military guy, black guy, same exact case, and we did I think around 1,000 FUEs in one day, which is tough in curly-haired people. Because remember, with FUE, you're taking a cylindrical punch and you're coming in over top of a hair, and you're trying to hit that hair and score the skin around the whole follicle down so that we can reach in and grab the follicle. And it's hard enough with straight-haired guys, and you throw a curly-haired person in there, and it becomes trying to hit a bent corkscrew with a perfect cylinder. Nevertheless, we had a really good day on Monday this week, and we did exactly this case with FUE. And the guy rotates back into our area in about a year and a half. So hopefully we'll get some good pictures, because his grafts were equally as good as the fellow in this example. So that would be the alternative is FUE. It just costs more, and it's not quite as sure of a thing, but it would allow the avoidance of a linear scar. Fortunately, the guy in this video wound up with really quite a nice scar, and strip worked out perfectly for him. Thank you.